So I think what we should do is introduce this concept of what is health early on in medical school and get people to understand that if you improve health, that may be the best way to treat a perceived disease process rather than trying to attack the disease directly. By the time the disease has established, the Alzheimer's, the cancer, the Parkinson's, it's a very late stage, and you should try to be improving the health of humanity at a much earlier stage before these diseases even appear, and that will get rid of most of them before they even have a chance to arise. In people who already have the disease, you can still apply these therapies. I think we need to get more evidence, but I think you can to improve them. This all needs to be taught early on in medical school, that as doctors, we should be improving health, not managing disease. That's it. I'll say it again because most of the people watching this still won't get it, even though if I say it 100 times. Doctors should be improving health, not managing disease. And if doctors are really aiming to improve health, they should be doing these protocols themselves. So you should always ask your doctor, do you do these things yourselves? If they do not, they don't understand the power of it, or they don't care, one of the two. If that's the case, then I have a problem with how that person is approaching the whole thing.
A great day, everyone. I am Dr. Don Agcopra, and welcome once again to this new episode of the Low-Carb Health Doctor podcast. Today, we are very much honored to have as our guest a fellow neurologist. He is a Canadian, but he's now based in New Zealand. What makes this session especially unique is that, as far as I know, he is only one of the few other neurologists in the world who is much into metabolic health. He is a renowned board-certified neurologist focusing much into metabolic approaches for neurological diseases. He completed his neurology training at the Royal Melbourne Hospital in Australia, but is currently practicing neurology at the Waikato Hospital in New Zealand. And more recently, he has pioneered research into the therapeutic benefits of fasting and ketogenic diets in conditions such as Alzheimer's disease, Parkinson's disease, and other neurodegenerative disorders. So help me welcome to the Low-Carb Health Doctor podcast, Dr. Matthew Phillips. A great day to you, Matt.
Thank you, Don. It's a pleasure to be here.
So what specifically got me interested into having you into this podcast, Dr. Phillips, is the fact that you are much into metabolic neurological interventions for neurodegenerative disease, which is really a very, very novel field if we have to take mainstream neurology and mainstream medicine into consideration. And I'm very much interested, and as well as all the listeners to this podcast, most likely, we are very much interested in knowing the beginnings of your journey into this field of metabolic neurology. Could you share with us, Dr. Phillips, your journey, how you got into metabolic neurology and what inspired you to explore this path and focus on metabolic neurology strategies like fasting, ketogenic diets, as well as other related interventions that could indeed be potential therapies for neurological disorders?
Sure. I think a lot of the inspiration behind it started out in childhood, which it often does with things that become sort of the dominant missions of a person's life. So as a kid, I had a little, my dad was a physician. He was actually a internal medicine doctor or general physician. And he brought this little brain model home one day when I was a kid. And I was taking it apart and putting it together and trying to figure out all the different bits of the brain. And I think that influenced me quite a bit. I was fascinated by the cerebral cortex and the thalamus and all these different brain structures. And then, as the years went on, I sort of saw what my dad was doing, and I thought, well, he's actually going away and helping people and healing them and coming back and having dinner and then going and doing it again. And I thought that was very inspiring and cool. I guess in medical school, it was then I realized that actually what most doctors do is treat symptoms of diseases rather than heal them. And there are some exceptions, but generally doctors treat symptoms. And that was very crushingly disappointing to me at the time. This was second year of medical school. So I guess I just sort of decided to keep training for a few years, and then, I eventually became a neurologist, as you say, still kind of frustrated deep down by this fact that I didn't feel like I was actually healing anyone. I was just giving them some medications, telling them to go home and just wait for things to get worse. So that's why I decided after my training was over not to take a posting anywhere right away, or not even do a PhD or anything like that. I decided to just complete a one-year fellowship in nerve and muscle disorder, sort of nerve and muscle measuring techniques, neurophysiology, as you know. And then I went traveling for the next 3 years. And during that time, I did a lot of work and volunteering and other things. But it was during that time where I had some breathing space for my brain, and I could actually sort of think about ways to heal people that didn't involve medications, that just masked symptoms. And I ended up looking at quite a few things, really. And ended up sort of discarding most of them as not having great enough potential to help humanity with a lot of these terrible disorders like the ones you listed. But fasting and ketogenic diets kept coming back at me, and the reasons were they were evolutionary based, which a lot of people don't really understand. And they also changed so many different mechanisms inside the body. They actually changed the body in a way that really supported brain function and neurological health, from what I could see, theoretically, to a very large extent. And that interested me, because that meant maybe there was a way to heal the brain that could actually be used to help people with Alzheimer's, Parkinson's, ALS, Huntington's, these terrible disorders that didn't involve medications, that maybe could be used with medications, but that actually had a greater effect in the longer term. And that is what led me to do the research in the disorders that you mentioned.
When we talk about those things that you just mentioned a while earlier, Dr. Phillips, it is truly let's say a trailblazing field when it comes to approaching these neurodegenerative diseases, because for most doctors, and including neurologists, fellow neurologists worldwide, these things about non-mainstream, non-pharmacologic interventions are really something even quite unheard of, if I think you would agree to that.
Yes, so, we have to get past that. I agree.
Yeah. So, in brief, what would you say are the main mechanisms of action, how these interventions, these metabolic interventions, are effective in addressing these neurologic degenerative diseases from your end, based on your research and your own experience with your patients?
So it's good to think really simple about these things, first of all. I can get into some mechanisms in a minute, but think the body is there to support the brain. All of the systems, the heart, the lungs, the kidneys, all of it is there to support the brain. It's where we are basically brain support systems. And so what these metabolic therapies do, fasting protocols, ketogenic diet protocols, applied properly, is they make the body healthier and better able to support the brain. In addition to that, they also improve brain health. And there's a lot of evidence behind both of those statements I just said, because I realize that some people might think even those statements are contentious, but there's a lot of research supporting the idea that fasting and ketogenic diet protocols improve body health, peripheral insulin resistance, type 2 diabetes, hypertension, all these things. And they also improve brain health, insulin resistance in the brain. Other mechanisms that these things sort of alter to improve brain health include reducing neuroinflammation. A lot of these disorders, Alzheimer's, Parkinson's, so on, have a little bit of neuroinflammation, which is sort of a damaging process that exists throughout widespread regions of the brain. They also generate these things called ketones, which is where the namesake comes from for the ketogenic diet in particular. Ketone is a molecule in the body that we can use, everyone can use, and our hunter-gatherer ancestors in evolution used them a lot. But we don't use them so much anymore with the current dietary lifestyle, which involves many meals a day and a lot of high-processed carbohydrates, such as rice and grains and pasta and sugar. So when you get rid of those things and you start extending your meals out, eating fewer times a day, then your body has to replace the glucose, which is the fuel that most people are running on, with a different fuel called the ketone. And most of the work in doing that ketogenesis is done by the liver. But other parts of the body can do it too. Now, when the ketones are made, these have a lot of theoretical, and we are seeing now in the last few years studies showing practical benefits on brain health, which include improving the energy distribution and usage of the brain. And Alzheimer's, Parkinson's, all these disorders involve serious problems with brain energy usage. So you improve the ability of the brain to use the energy it has when you are making ketones. At the same time, the ketones are associated with reduced neuroinflammation and reduced free radical production. And free radical production, which probably large part causes the neuroinflammation, is a very damaging thing that destroys very slowly over years, destroys different bits of the brain at a cellular and mitochondrial level. Mitochondria are the little batteries in the cells. So those are some of the mechanisms that fasting and ketogenic diet therapies both do, is they increase ketones, which improve energy, reduce damage, reduce neuroinflammation. They also do other great things like activating immune system function. So people who do these protocols properly rarely, if ever, get sick. Okay, if you're doing these properly, you should really, and assuming you're coming from a baseline state of decent health, you should rarely, if ever, get sick with colds and flus and all those things. Yeah, there are many other things that they do. Basically, these therapies, compared to medications, induce an orchestra of changes. So dozens or even hundreds of different changes in the body, many of which are aimed at improving health. Medications, by contrast, think of it this way, change one or maybe a handful of pathways within the body, enzyme pathways and so on, that are mainly oriented towards improving symptoms. And so I think it is a good thing to use metabolic therapies and medications together, relying more on the metabolic therapies. And in the long term, if you do this properly, I suspect, and the evidence would agree with me on this, that you start to see benefits as the weeks and months and maybe years go by.
It is truly enlightening to be hearing all that from you, Dr. Phillips, because in my case, I got into metabolic neurology more into, as similar to yours, the ketogenic and low carbohydrate nutrition approach, as well as intermittent fasting every now and then, based on my own personal experience of having been diagnosed with metabolic syndrome myself, and then later on reversing that metabolic syndrome process and then applying it to my own patients, and thereafter knowing that there is a broad base of literature, medical literature actually, covering all of these topics that I haven't personally encountered much in medical school and even in medical and neurologic conferences. So you mentioned earlier about insulin resistance. So from your end, do you think insulin resistance is really a very important phenomenon when it comes to approaching neurodegenerative diseases like, for example, Alzheimer's, Parkinson's, and what's your take on that?
The short answer is yes, but perhaps not as important as it is for someone with type 2 diabetes. So insulin is a hormone that enables glucose in the blood to be used by cells. When the insulin levels go up, many cells, muscle, fat, organ cells, can take up the glucose when the insulin's present and use it for energy. Now, type 2 diabetes has insulin resistance in a lot of those tissues, the muscles, the liver, and other organs, and so on. And so it's very, very important to reduce insulin resistance in type 2 diabetes and pre-diabetes if you want to put that into remission, like you did, and well done, by the way. When it comes to brain insulin resistance, I think it's a little more complicated because Alzheimer's, if we look at just Alzheimer's and Parkinson's, for example, the two most common neurodegenerative disorders, they both show widespread brain insulin resistance throughout the brain, but it largely affects different structures with some overlap. So the pattern is a little different. And also the insulin resistance in, say, Alzheimer's, some people call it type 3 diabetes. It's characterized by not just the insulin resistance, but also low insulin levels as well. Whereas with type 2 diabetes, a lot of people have high insulin levels. It's just the cells are resistant. So the insulin can't do what it needs to do. So there are differences, and I think it's more complicated in Alzheimer's and Parkinson's. And the metabolic therapies do probably help the insulin resistance in these disorders. And there's some beautiful work done by a number of people. Another fellow neurologist named in Canada named Stephen Cunnane, who is involved in a lot of this work, showing that brain insulin resistance can be bypassed by the ketones in Alzheimer's and Parkinson's. Wonderful work, but basically, I think it's more complicated, and there's more to it than just the insulin resistance. The core of it, if you want to jump straight to the punchline, is the mitochondria, in my perspective. The mitochondria are the main little energy makers in all of the neurons and all of the cells throughout the body, almost all of them. And there are a few hundred in most cells of these mitochondria, and they come together and they move apart and they change shapes, and they actually do more than just produce energy. You think of them as, I heard an expression recently, they are the CEOs of energy distribution and production within the cells. So they control how the energy is distributed. And you can think of the nucleus of the cell, the big bunch of genes there, as this sort of repository that the mitochondria can go to use when they need it. So this is the key of it, in my perspective, is that you have to heal up the mitochondria to improve the cells. Now, this is extremely difficult for most people to understand, because in medical school and the neurology conferences, as you mentioned, as I feel the same frustration with, we do not learn a mitocentric point of view. We learn a cell-centric point of view for the last couple hundred years, that cells are the fundamental unit of life, and that the neuron is what matters, and that the mitochondria are just one organelle amongst many in there. This is an incorrect view, in my opinion. We must convert this view at an early level, in first-year medical students, and even in high school or even earlier, that the mitochondria perhaps are the fundamental unit of life, and the cell is the housing by which they live in, and they take care of it and help it function. So if we can change that singular view, from changing it from a cell-centric to a mitocentric view, I think that would have a tremendous amount of beneficial impact on these disorders, the lifestyle disorders of Alzheimer's, Parkinson's, ALS, Lou Gehrig's, and other disorders, probably even a lot of the cancer disorders and so on. So it's that shift in thinking that I think is really missing. There are other problems too. I don't deny it. Corporate financial gain is a big one in the West to overcome. But really, it's that view that makes most physicians completely blind to these therapies and view them just as a silly fasting fad or a silly dietary fad, because they're not thinking from a mitocentric perspective. They're thinking from a cell-centric perspective. And if you ignore the mitochondria, then you could argue that fasting and diet protocols, ketogenic diet protocols, are not that important.
Hey everyone, I'm Dr. Don Agcopra of Low-Carb Health MD and Low-Carb Neurologist.com.
It is my passion to help you live your longest and healthiest life. That's why we created KetoMetabolix, a comprehensive platform designed specifically to help you in your journey towards optimum longevity and health. And that means increasing your lifespan and health span. At KetoMetabolix, you will find so much more than just information. This is a hub where we dive deep into metabolic health through online courses, engaging webinars, and interactive workshops. Whether you prefer learning at your own pace from home or joining us for face-to-face presentations, KetoMetabolix brings you the science-backed strategies and practical tools you need to optimize your metabolism. This isn't just about weight loss. It's about empowering yourself to control your diabetes, hypertension, as well as avoiding all other deadly complications of insulin resistance and metabolic syndrome, such as heart attacks, strokes, kidney failure, and cancer, among many others. This means adding quality years to your life and feeling vibrant again every single day. Are you ready to invest in your future health? Come explore everything KetoMetabolix has to offer, and let's start improving our lifespan and health span together. Scan this QR code today or visit KetoMetabolix at bit.ly/KetoMetabolix.
That's great to hear, Dr. Phillips, because when it comes to the mitochondria, I would still agree with you that this field, in terms of studying mitochondrial bioenergetics, is really one of the relatively much newer fields in medicine. I've been following much of the works, for example, of Professor Bin Bickman of Brigham Young University. I'm not sure if you've heard of him. And he is also much into mitochondrial bioenergetics, as well as how ketone bodies, specifically beta hydroxybutyrate, is really acting as a signaling molecule at the molecular and at the cellular level in terms of intervening in mitochondrial functions, for example. So mitochondrial bioenergetics is really a novel field that is quite difficult for many doctors, many physicians, and let's say even science researchers worldwide to comprehend as of now, especially if they're not much involved into it. So since we are already talking about the mitochondria, in your own experience and in your own research, how does the mitochondria factor in, and what are the, can you share with us research highlights from your end? I know that you've been much into doing your own research in Alzheimer's, Parkinson's, and I think to a certain extent also ALS, or the Lou Gehrig disease, amyotrophic lateral sclerosis, which is one of the relatively more common neurodegenerative diseases worldwide, though much less common than Alzheimer's and Parkinson's themselves. So can you give us a better idea what things have you encountered in your own research so far?
So when people talk about metabolic health, the perspective that I am adopting is that mitochondria are the core feature of metabolic health, because they control most, if not, all metabolism within the body. So restoring the mitochondria is the key, and therefore people should be fasting and eating not just to lose weight. That's a side effect. Not even just to improve their pre-diabetes. That's a side effect. But to improve their mitochondria. So every meal I have and every fasting session I engage in, which is like all the time, you're either fasting or eating, is I'm trying to be aware that I'm improving mitochondrial health. And that's what keeps you going and sticking to these things very, very, very well. Now, highlights of research. Most of the research into these disorders has been done on ketogenic diets in terms of metabolic health. Some studies have looked at fasting, but I'll talk about the ones we've done because those are the ones I'm most familiar with, and I'll just do it in brief. And keep in mind, I'm only going to talk about humans. There's a lot of research in animals, so mice and rats, that shows benefits, but there's this thing called translational medicine where it's often the benefits in a mouse or a rat do not translate to a human, at least not in the same way. So I will ignore that data for now, although realistically it shouldn't be ignored, but I don't think it's as important as human data. So our first study was a randomized control trial, which is a very good kind of design for a clinical study in Parkinson's disease. And we basically, all we did was we took two groups of people who had similar levels of Parkinson's disease, and we split them in half into a ketogenic group and a low-fat diet group. And the low-fat diet was a very good diet with lots of fiber and grains and so on. And we just did that for 2 months, 8 weeks, and measured their Parkinson's at the beginning, middle, and end, and found that by the end, both groups had improved, but the ketogenic diet group improved quite a bit more, particularly in a lot of the non-motor symptoms of Parkinson's, which many people who may not know about Parkinson's disease, most of the quality of life reduction, the problems associated with that disorder, as you would know, Don, come from not the shaking and the rigidity. That's a problem, but a lot of it comes from the mood problems that are associated with it. So depression and anxiety being examples, the sleep problems that are associated with it, the subtle changes in thinking. There are subtle changes in cognition and in cognitive impairment. There are pain syndromes. There's fatigue throughout the day. There's a lot of other things that go wrong, and those improved quite a lot in only 2 months on the ketogenic diet. So that was very encouraging, and to date, I believe that remains the largest or maybe the only randomized controlled trial to look at Parkinson's in its entirety. The next one we did was an Alzheimer's, so similar kind of design, but it was a randomized crossover trial, which is a little more powerful and allows you to get to do a study with even fewer patients. So that was 26 patients. But it doesn't sound like it's not as many patients, but it was actually probably statistically more powerful in that every patient got to try the ketogenic diet as well as a standard of care sort of dietitian recommended diet. Which was again high in fiber and low in fat and full of whole fiber grains and fruits and vegetables and those things. So what we did is we split the group into two. So half of them did the ketogenic diet for 3 months this time, 12 weeks, and the other half did the standard of care diet. And then we gave everyone a washout, so everyone took a break from all and went back to their normal pre-study diet for a couple months. And then we flipped them, so the ketogenic guys did the standard of care diet, and the standard of care people did the ketogenic diet for the next 3 months or 12 weeks. So the whole thing took like sort of about 8 months. And that's extremely powerful because every single participant in the trial got to do both diets. So what we found at the end of that was that the Alzheimer's cognition improved, but it did not improve to a statistically significant extent. So it got better, but not enough to say this is definitely real. It was enticing. But the other two things we looked at mainly were the people's daily function and their quality of life. And now, when you ask someone with Alzheimer's or someone who lives with someone with Alzheimer's, what are the most important things to you? They will not say my cognition. Most of them will say how I function throughout the day and my quality of life throughout the day. These are things that matter. And both of those things improved in the trial to a significant extent that was not just statistically significant, but clinically meaningful, as in it made a difference to the person. So it was a large effect. And that was kind of exciting because that was the first sort of randomized trial looking at a patient population of just Alzheimer's, no mild cognitive impairments, no subjective cognitive impairments, just Alzheimer's. And it showed that there may well be something to this approach in these people with this terrible disorder. If you know anyone with Alzheimer's, it's a really tough one. So after that, we've been sort of working on a few different case studies when it comes to neurodegenerative disorders, ALS or Lou Gehrig's disease, the motor neuron disease. We put one person through that for 12 months, so a year, and he's still on that. And he did very well. 18 months. He did it for 18 months. And he's still on that. He did very well. He came off it for about 6 months after we published the study, and he declined. But then he went back onto it, and he's remained pretty stable since. So it was nice to see that cause and effect. Although I wish he hadn't gone off it for 6 months because he declined quite a bit during that time. And then we've done one in a fellow with Huntington's, which is also extremely difficult neurological disorder, and he did 12 months of the ketogenic diet, showed improvements, and he's been sort of spotty with his adherence, bit off, bit on, but he's adhering to it pretty well most of the time, and he's actually he's probably progressing very slowly, but he's been pretty stable too. And he was both the ALS fellow and the Huntington's fellow were progressing very rapidly beforehand. So that's sort of a spread shot of the human evidence. Those are the only two studies involving people with ALS or Huntington's out there, to my knowledge. I don't think there's any other studies out there of these approaches in people, and they were both encouraging. So that's a lot of our work. The other half of the work that I do relates to cancer, and we're doing a big trial right now in that, which has been going for over 3 years now. So we probably won't talk about that. But with respect to neurodegenerative disorders, those are the top 4 in terms of how common they are, and that's the state of the art to date, if you will.
Yeah, I came across recently with that ALS case report that you did get to publish, which was quite impressive. And understandably, since ALS and Huntington's are relatively less common than Alzheimer's and Parkinson, so I suppose it would be easy for us to understand why we don't get to try out this metabolic therapies to such subsets of patients. More recently, I got an ALS patient here in my own neurologic practice, which also, since I encountered that case report that you did publish, I am trying my best also to intervene using the Ketogenic Metabolic Therapy with that patient, and that patient has been following up with me for, if I remember it right, more or less 4 to 5 months. And so far, I am not yet able to say the medium to long-term outcome with that, but I do hope that patient, if he will be very much compliant to the metabolic intervention that I am trying to integrate in his in his management. So I hope he will indeed somehow improve to some extent. So you did mention about brain tumors, which is still part of our neurologic practice, and I've heard you've done studies on glioblastoma. Is that right? Glioblastoma multiforme patients. Yeah. So can you tell us something about that as well?
Oh, sure.
And how are they doing so far? And what interventions are you doing?
Yeah. So we've done a little 10-patient case series a few years ago where it was just experimental, and these were glioblastoma patients, which is basically the worst brain cancer one can get. One of the worst cancers one can get, which is saying something. And that study was just to see if people with advanced glioblastoma, these were people who had been diagnosed on average, half a year earlier, could even do a strong fasting ketogenic diet protocol, and they did. So that encouraged me to seek ethics consent to apply it in people and perhaps try it in glioblastoma patients that were just diagnosed. So we did a case study that came out early last year in one lady who did very well, survived for over 3 years with a glioblastoma. And the first 2 years, the glioblastoma disappeared. And, I should mention this was done in conjunction with her standard chemo and radiation and surgery, not as a separate thing, in conjunction. I'm a believer that it's important to be able to use these metabolic therapies with the standard treatments. And she did very well, and then there were some things that happened that perhaps rocked her adherence a little bit, and then the glioblastoma slowly came back, but she did make it past 3 years, which for the kind of tumor she had, less than 5% of people do. So that was kind of encouraging. And so now what we're doing is a formal clinical trial of almost 20 patients with glioblastoma, same tumor that she had. And none of them are, they're all true glioblastomas. None of them are grade 4 astrocytoma, which a lot of the studies out there in the literature are called glioblastoma multiforme, but if you look at them carefully, they're actually grade 4 astrocytomas, which are have a better prognosis. So in this one, we're just looking at glioblastoma and seeing, basically, can they do an extremely intensive, this is a much more intensive fasting keto diet protocol than I apply to the Alzheimer's or Parkinson's patients. And can they do it? And then is it safe? And is it something that's not going to hurt them? And so far, it looks pretty promising on those scores. But of course, we want to know if it helps their quality of life and helps them live longer. And that data, I can't really say with confidence, 100% confidence yet. It's looking enticing, but I can't really say yet because the study's still ongoing. The first patient is, we're sort of just over 3 years into the study, and I just need to give it a lot of time and see how things go. But what I can say is probably when it comes to these metabolic therapies for these really, really super tough disorders like ALS and glioblastoma is I think we're going to find that it's more effective for some people than others. Some people you can get superb results, others maybe not. Across the board, what I care about is the average. The average is what matters because that's what you have to show is that on average this helps or this doesn't help or this has no effect. And I think on average it probably, the data to date anyways would suggest that perhaps these things can slow down these terrible disorders, but in many people on average. But in order to stop them, we may need to advance our metabolic therapies in future by trying different things in addition to the fasting keto diet protocols and even things like using metabolic-based medications that don't aim to mask symptoms, but aim to do something else that helps the fasting ketogenic diet approach in the long term. So, yeah, that's our work in glioblastoma. I don't imagine that study will be published for a year or two, and longer is better, really. I need to wait a longer and see how things go.
Yeah, I'm sure many people would be looking forward to the results of that study in glioblastoma because more recently I got into my podcast. I'm not sure if you are familiar with Professor Thomas Seyfried of Boston College and his breast pulse protocol and the studies that he and his team has been doing, which is more or less aligned also with that thing about glioblastoma that you are currently doing. And through him, I also got to know about Pablo Kelly and Andrew Scrubber, both in the UK. And I think it was, excuse me, Pablo Kelly, who is the glioblastoma patient who survived actually more than 10 years already just on this breast pulse protocol, mostly with the ketogenic metabolic therapy plus some, I don't know if there was an adjuvant chemotherapy involved, but sad to know he passed away late last year because of neurosurgical complications related to debulking of the tumor recurrence because as far as I'm aware, he somehow messed up his ketogenic interventions, and I think that's one of the main reasons why there was some kind of recurrence of the main glioblastoma tumor.
Yeah. So Pablo that's a sad story at the end there, but he did very well. Again, it's important to realize from what I read, he had a grade 4 astrocytoma, which we used to call glioblastoma, but no longer do. So the prognosis, not to take nothing away from him at all. What he did was incredible, and living over 10 years with grade 4 astrocytoma is also incredible. But it was not quite the same as glioblastoma, and I think he was a great proof of concept of the approach. But we're going to need to get more rigorous sort of trials and things going in order to really convince a lot of other people.
Yeah, I do agree with you on that because trials like what you're doing are really what we would call the evidence that we as physicians are looking for in terms of translating these newer strategies, including these metabolic strategies that we are talking about, so that eventually they will be adopted into what would be called mainstream medical practice, hopefully. So, since this is a relatively new concept, so I'm sure there are challenges and misconceptions along the way that you face. I know that firsthand because in my own practice, integrating this metabolic neurologic interventions, I know I have my own pushback. So in your case, Dr. Phillips, what would you think are the biggest challenges and misconceptions that you are currently facing when you are advocating for this metabolic strategies in neurology?
Yeah, that's a great question, Don. So the biggest one from my view is the one we alluded to earlier, is how we conceive health and disease, how we think of a person as healthy and how we think of a person as disease. So in medicine, we're trained to treat disease. We're not trained to improve health. And that goes way back to medical school and even before. What we should be doing, I think, is in medical school is training physicians to understand health, what health is and what disease is, and that health is not just the absence of disease. It's a different process that we should be trying to promote. Rather than trying to eliminate and attack disease, we should primarily be trying to restore health, because if you restore health, disease will fade away. That is what we should be trying to promote. And if people truly understand that, they will adopt healthy strategies in their own lives. If they do not, so people, when I go to conferences, and I do see a lot of colleagues that I won't say any names who don't do fasting protocols. I see them eating garbage food from some fast food or just lots of different carbohydrates and fats combined and stuff. And clearly their health is not optimal based on how they look, and yet they go up and speak about ketogenic diets and fasting protocols and stuff. This makes no sense to me. So if you really are understand metabolic health at this deep level, and that you're trying to restore your mitochondria, a person should be doing the fasting, a fasting protocol, a low carb or ketogenic diet protocol, or some kind of diet modification. A high fat, low carb could be okay too, done properly with a lot of fiber. That's fine. The Asian paradox, a lot of the diets in Southeast Asia are high carbohydrate, low fat, with lots of variety and lots of fiber. That's okay too. But one should be doing that. And if someone is not doing that, then that either means they don't really believe in the metabolic health approach, or they don't care. So one of the two. So I think that, or they don't understand it, I should say. They don't understand it or they don't care. And so I think what we should do is introduce this concept of what is health early on in medical school, and get people to understand that if you improve health, that may be the best way to treat a perceived disease process, rather than trying to attack the disease directly, right? By the time the disease has established, the Alzheimer's, the cancer, the Parkinson's, it's a very late stage, and you should try to be improving the health of humanity at a much earlier stage, before these diseases even appear, and that will get rid of most of them before they even have a chance to arise. In people who already have the disease, you can still apply these therapies. I think we need to get more evidence, but I think you can, to improve them. And so this all needs to be taught early on in medical school, that as doctors, we should be improving health, not managing disease. That's it. If we have to, I'll say it again, because most of the people watching this still won't get it, even though if I say it 100 times. Doctors should be improving health, not managing disease. And if doctors are really aiming to improve health, they should be doing these protocols themselves. So you should always ask your doctor, do you do these things yourselves? If they do not, I'm a purist on this. If they do not, they don't understand the power of it, or they don't care, one of the two. If that's the case, then I have a problem with how that person is approaching the whole thing. Okay, so once more, doctors should improve health, not just manage disease. The first is more important.
Yeah, that is very interesting. That perception is really a very interesting one to understand, Dr. Phillips, because in my own case, what I seem to perceive is that doctors who have themselves gone through the process and experienced these interventions, like for example, I'm talking for myself because I'm really doing this myself, and for the past 4 years, I really would say that the benefits are really immense, and I am reaping all the benefits that I have been exposing myself to in terms of this ketogenic metabolic therapy, for example, especially when it comes to the low carbohydrate, healthy fats dietary intervention. I can speak for myself that it's really doing a lot of amazing things that I would not have otherwise been experiencing if I am not into this lifestyle nowadays. So when you mentioned, I came across this recent paper that you published on the mitochondria and specifically this concept of mitohormesis. So would you mind expounding a bit on that for the benefit of everyone listening, this concept about mitohormesis?
Sure.
How are you going to explain that to the layman and to our fellow physicians that are listening?
Yeah, I'll try. So, so far we've discussed about healing mitochondria as the key element in improving the symptoms of people with Alzheimer's, Parkinson's, maybe cancer, and so on. How do you do that is the question. So one way to do that is to have the ketones that are associated with some benefits on mitochondrial function and mitochondrial health. And also, when you reduce neuroinflammation and things like this, that can help them as well. But I guess mitohormesis is a sort of concept that really envelops a whole range of approaches as to how to improve mitochondrial health. And I guess I need to define, hormesis refers to the fact that if you expose someone or cell or an organism to a stressor, any kind of stressor in a small amount, if you keep doing that and give them enough recovery time, they'll eventually become more resilient and able to handle larger amounts of that stressor in future. An example is, a lot of the poisons that have been used throughout human history. Some people would drink small amounts of a poisonous substance, and it might make them a bit sick or something, but not enough to kill them. And then if you kept doing that, the body would adjust to it, and eventually that person could actually drink a lot of poison that might kill the mass majority of people, but they'd be mostly immune to it because they've undergone hormesis, which is sort of this improvement of cell and body health and strengthening against that particular stressor. So if you translate that to mitohormesis, which just means improving mitochondrial health the same way, exposing mitochondria to smallish stressors of all kinds slowly over time with a sufficient recovery period so they can get stronger between the stressors, then maybe you can improve the mitochondrial health in the long term and make them more resistant to getting Alzheimer's, more resistant to getting cancers, and all these other things too. So it's a concept that is fascinating, but not an easy one to implement, because what it means is you have to make a lot of changes in the lifestyle in order to try and do this. So one way to do it is, one way to envision this is looking at stressors on this side and recovery phase factors on the other side. So a stressor would be food. Food is a stress to the body. When you eat food, even a ketogenic diet, it's a stress. A high carbohydrate, high fat diet will be a big stress on the mitochondria, but a ketogenic diet will be a relatively mild stress, a stress nonetheless. Whereas a fast is where they can recover. There's no food coming in. They don't have to metabolize and deal with all these nutrients and stuff coming in, which we know that fasting enables the mitochondria to undergo mitochondrial biogenesis or mitogenesis, so birth new ones, and they can also undergo mitophagy, which is removing junky old ones, so they can improve their health that way. So, but it's exposing them to the feeds followed by the fasts that's important, and that will encourage mitohormesis if you have a nice balance between the two. Other ways to look at mitohormesis is not just through dietary changes, but through exercise, for example, physical changes. So exercise itself is a wonderful thing, we know, to a point, right? If you do too much, it's too much of a stressor. And this is a big factor in ALS. People who exercise too much are more prone to getting ALS. And so high-level athletes, that's why there's a reason why high-level athletes get a lot more ALS than other disorders. So for some reason, this is a problem with it. So, but nonetheless, mild to moderate forms of exercise, recreational exercise is a good thing, but you got to balance it out with recovery protocols, rest, including sleep. And if you don't do that, it's a bad thing. So that will encourage mitohormesis, not the exercise itself, but the recovery periods as well. So exercising and recovering and focusing not just on the exercise, but the recovery period itself, making sure your recovery is deep and meaningful. And there are many different ways to do that through different protocols that enhance sleep, that enhance this thing called non-sleep deep rest. Yoga Nidra, which is a very powerful one, of course. These are all wonderful ways to improve your recovery from the exercise. So most people are a bit myopic. They look at the stressors too much when it comes to health. They go, oh, you got to have a nice diet. Oh, you got to exercise properly and other things too. It's not just that. I do not think that is the way to health. The way to health is to go, okay, you got a great diet. Now you got to have a great recovery protocol, fasting protocol. You got a great exercise program? Fine. You got to have a good recovery protocol. Otherwise, you're not. It's the recovery protocols where your body actually improves the most in terms of health. The diet and exercise part are the stressor that induce a degree of damage. You need these parts over here, that the recovery protocols, the fasting protocols, so on, to actually capitalize on your excellent diet and exercise regimens. So that's mitohormesis. It's using a balance between stress and recovery to improve your mitochondrial health in the long term. And if you can do that, I suspect you're going to have huge, significant benefits on not just lifespan, but health span, which is, lifespan is this concept of many years of life. But we don't want just lifespan, we want health span, where you have more years where you have a functionally meaningful life, where you have good cognition, you have good physical function, and you can, be 100 years old and play with your great grandkids and all these things.
So the way I'm perceiving it is like the ketogenic diet intervention somehow works as a mild stressor specifically to the mitochondrial functioning itself, and then afterwards you introduce the fasting protocol as a sort of recovery. Am I getting it correctly?
That's exactly right. So most people view, and this is where I disagree with most people, even in the sphere, that I think they see the ketogenic diet as having all these metabolic mechanisms and improving metabolic health through all these different mechanisms. I don't disagree with that. But at the end of the day, if mitohormesis is correct, and there's a lot of evidence underlying this, one of the most powerful, if not the most powerful aspects of the ketogenic diet, and the same with a high-carb, low-fat diet that's properly performed, but it can never be as good for various reasons, is that the ketogenic diet is a mild stressor that properly timed with the fasts enhances mitohormesis, which enables the mitochondria to recover properly because it's not inducing as much damage, and then you keep that up, you get a lot of these mitohormetic benefits in the long term. So yeah, I think that's a hugely underrated, under-recognized mechanism as to potentially how a ketogenic diet might improve health and improve symptoms ultimately in people with these neurodegenerative disorders. But I'm a little low. That's a very that's not a common point of view. So just listeners should be aware of that. And there's all these other mechanisms that are benefited by the ketogenic diet too that I don't disagree with.
So with that, Dr. Phillips, the way I'm getting it's like, in your opinion, there is an added, let's say, advantage for a fasting protocol far and beyond what a ketogenic diet and nutritional ketosis can do. Because the way I am perceiving it before is like when we do fasting protocols, because it somehow produces that level of starvation ketosis in our bloodstream, which does have the benefits due to the ketosis levels due to fasting. And then here comes the ketogenic diet, which is more or less targeted towards producing also nutritional ketosis, but in a little bit different way from fasting, because when you do fasting, it's like really you avoid intake of food, you avoid intake of calories, whereas ketogenic diet, you focus on certain specific foods that will help you produce nutritional ketosis in your body systems. So for you, that means there is a difference in terms of benefits with fasting as compared to sticking purely on a ketogenic metabolic dietary protocol.
Yes, you summed it up nicely. They have overlapping but semi-distinct benefits. So they both induce ketosis. Ketogenic diet just gets most of the fat from food. Fasting gets most of the fat from your body fat. But they're going to, regardless of the fat source, they're both going to induce ketones, which have all these other mechanistic benefits that we've been discussing. Longer fasting is more powerful at that, ultimately, than the ketogenic diet, but you can't do fasting indefinitely because at some point one must eat. Okay, so the long fasts, like 5-day, 6-day, 7-day fasts, are very powerful. You can get higher ketones, lower glucose, and which in theory, is associated with greater benefits on mitochondrial health to a point. Now, where fasting really differs from the keto diet is, yes, I see the ketogenic diet as a stress, albeit a relatively minor one, on the mitochondria that can encourage hormesis. But if you just ate a ketogenic diet 6 times a day, I would not be in favor of that because the mitochondria aren't getting a recovery. You need to balance that out with fasting periods that, yes, they induce ketosis too, but they more importantly allow the mitochondria to recover, stop the nutrient influx, think of it as letting the mitochondria transform themselves and become more efficient because there's much less energy available. It gives them a chance to change themselves into a better version of what they could be and a healthier one. Now, again, you can't do the recovery forever too, because at some point that becomes detrimental. So you need to balance the ketogenic diet and the fasts out, but just doing one or the other is no help. If I had to choose, and this is what I say to people in my clinic, because I have to be honest with them and say, look, the evidence is still building. I don't know if this is going to help you. But if you got to choose one, I do not choose the ketogenic diet. I choose the fasting protocol. I say to people, look, you got to do one thing. It's going to be easiest for you to do. That's going to be cheaper for you to do. It's just to implement a fasting protocol first. Don't worry about the ketogenic diet. Don't even change whatever you're eating. Keep eating what you're doing. But if you could change your 6 meals a day, which most people are eating 5 or 6 when you include snacks, to just 2 big meals a day and nothing between that except water, tea, black coffee, that would be the best intervention what most people could do in order to improve their metabolic health with respect to the diabetes, the prediabetes, the blood pressure problems, weight, and so on, cholesterol profile, and also potentially neurological health. So I think I would go with the fasting, but if they can do both, then of course make those 2 big meals low carb. Or if you really want to go hardcore, I think for brain health, you need to go a little more hardcore than low carb. You got to go ketogenic if you already have a disorder established. I suspect there's going to be a correlation with being ketogenic and greater benefits that'll be shown whenever that gets shown in the next few years or decades. But yeah, that is my conception exactly. So ketogenic diets in summary and fasting protocols in summary have similar mechanisms, the ketogenic aspects, but they do differ from a mitohormetic perspective in terms of how they work. And I do think the mitohormetic perspective, the mitohormesis, is a very underappreciated aspect of how we could potentially improve these disorders in a lot of people.
When you talk about fasting, are you essentially telling us about intermittent fasting or a longer term fasting? What are you? Yeah, what's your take on that?
Good point. So both. So you can roughly divide fasting into intermittent, as you say, and then sort of periodic or prolonged. It's somewhat arbitrary, but most people say that at least 12 hours up to 24 or 48 hours is an intermittent fast. So an intermittent fast is something you do every day. And when I talk to people, if they do sort of 2 meals a day or 1 meal a day, then they are almost certainly introducing at least 12 hours of fasting into every single day. And that's great. There's different ways you can do it, though. You can do a 60 and an 8 or a 20 and 4, which is 16 hours of fasting, 8 hours eating window every day, or 20 hours fasting, 4 hours eating window every day. There's many ways to do it. But that's intermittent fasting. Now, the prolonged or periodic fasting is something that's probably at least 48 hours long. So we call this a multi-day fast is another name for it. Most of them would be 2 to 7 days. So 2 days to a week. And I don't recommend these routinely. We do employ them in some of our trials, such as cancer, because these are much more powerful, but they have to be done a little more carefully to make sure, for most people, they have to make sure they get enough water and salt in order to do them properly. And then they're very safe, but they should be probably more supervised medically. And so those I guess I favor in some people who perhaps have a more serious medical condition, that like maybe they have really severe type 2 diabetes. That would count. That really needs to be brought into line. And these longer fasts can be very effective in doing that. Can they be effective in Parkinson's, Alzheimer's? I'm not sure. I know some people that have done very long fasts, up to 1 or even 2 months. These are incredibly long fasts, and I don't recommend those unless you've got someone who knows what they're doing supervising. So that's the 2 main kinds of fasting, and the beauty of the fasting is it's just doing nothing. It's basically just purposely doing nothing, as in not eating, and just making sure that you're incorporating this into every day. If you can do that, I suspect, like you have seen, and many other people I've spoken with, including myself, have seen, this can induce many benefits, not just purely physical benefits, but brain benefits, attention, focus, ability to go without food and have higher energy levels consistently throughout the day, better sleep, better mood, stabilized mood, and all these other things. Yeah, there's so much to it that is great. So I do think an intermittent fasting protocol is probably, for most people, the single most powerful intervention that any doctor in any country in the world could prescribe.
In those patients that you made studies on Alzheimer's and Parkinson's, I am curious if was there any fasting protocol integrated to that, or just a ketogenic diet protocol?
Yeah, no, so I should clarify that it was just a ketogenic diet in the Alzheimer's and Parkinson's trials. So 3 meals a day, and we allowed them to have a snack or 2 as they wanted. So there was really no fasting. The ALS and Huntington's guys, they did a combined protocol, which was I call it a time-restricted ketogenic diet. I think I've coined the term. And that just means time-restricted feeding combined with a ketogenic diet. So time-restricted feeding is a form of fasting, and we choose 1 or 2 meals a day. In those 2 studies, it was 2 meals a day. And you combine that with a ketogenic diet. So those guys combined them. But yeah, no, in the Alzheimer's Parkinson's study, they just did a ketogenic diet. I would like to do some fasting protocols in those guys, but it has to be done very carefully because particularly with Parkinson's, when people are on the levodopa, as you know, that is the levodopa, the main medication used in Parkinson's, it is improved when people are fasted, just because there's no protein. Protein makes it not function as well. The medication, it competes with its absorption. So basically, if we just fasted people who were on levodopa and they got better, it wouldn't prove that the fasting improved them. A critic, a skeptic, rightfully so, would say, oh, all you did was make the medication more effective. And I couldn't argue against that. So it would have to be done very carefully, but I think it could be done.
In terms of fasting and the ketogenic diet, because as you mentioned earlier, they may be 2 different protocols, but they may also be combined together. So like, for example, in my own case, in my own experience, and which I also successfully translated to the greatest majority of my patients, I stick to a ketogenic diet, of course, primarily for my own personal medical and health benefits. And then because of that, what I specifically discovered and encountered is that sticking to a low carbohydrate ketogenic diet really increases much of my satiety level, so much that I only get to eat once or twice a day. So in so doing, if I have to review my eating patterns, it's like almost every day I am really into intermittent fasting because I get to fast at least 12 to 14 hours or longer each and every day. So that's one of the reasons why I also advocated it to my patients. And the way I tell it to them, eat just only when you're hungry and stop eating when you're full. And if you are not really hungry, you're full, then you don't have to be eating at all. So it's like forget breakfast, lunch, dinner, just eat when you're hungry. So that's how I successfully I'm experiencing it in my own self and in my clinical practice. So they are really indeed doing a lot of wonders to these patients. So
that's excellent. I think it's key that you said you look forward to the fast. It's really important that a person understands once they really get it. You do look forward to your fasts. You know, people always look forward to eating, but this is a weird misconception of Western civilization in the post-agricultural era that you should also look forward to your fasts, not just your feeds. And I can tell you, I look forward to my fasts just as much as I do my feeding periods. And I think that's the correct balance. I am curious though, Don, I mean, feel free to answer or not. What foods do you use in the Philippines in order to apply a ketogenic diet protocol? Because I imagine it might be more challenging in that setting.
I think the main difference between the eating patterns in Southeast Asians and the Western countries would be the what we call the staple food. And in Southeast Asia, like here, Philippines, Vietnam, Malaysia, Indonesia, also in I think Japan and Korea, but to a lesser extent would be the presence of rice. Yeah, rice as a staple food. I'm sure you've been here in the Philippines before.
Definitely.
It's like they would say rice is life. It's like they cannot eat something without rice. So that's one of the major challenges that I have here with my patients because as you well know, carbohydrate is there is some degree of addiction really involved when it comes to carbohydrates, especially the more refined carbohydrates like the sugar and the flour. So this is the main challenge that I am encountering when I help my patients go on a lower carbohydrate dietary protocol, specifically more so if they have to go into a ketogenic dietary protocol to have better impact in terms of improving brain health, for example. So the way I integrate that into my own practice, first remove the refined high carbohydrate processed foods, especially those that are rich in sugar and flour. And the way I usually explain it to them is like, even if they are very like highly palatable or tasty or delicious or yummy, then you have to look at them as some kind of a poison. So I call sugar poison.
Nice.
And to a certain extent, flour, especially in those already with advanced metabolic diseases. So that's, I rightfully describe them as such. So it helps me a lot because when my patients do get to perceive them as poison. So no matter, like for example, a box of donuts, if you see it as poison because you are already metabolically dysfunctional, then it really helps a lot because it significantly improves your long-term outlook in terms of your survival because you avoid such complications in metabolic health. I'm curious though, Dr. Phillips, what do you eat yourself?
Yeah, no, that's fine. I have no problem answering that question. So first of all, I do 1 or 2 meals a day. So I'm very strict with my intermittent fasting. I do a sort of a 3 to 4 day fast on occasion. And particularly when I fly overseas, I'm actually flying to Philippines next week for about 10 days. I'm attending a wedding there. And I plan to do a fast appropriately in order to avoid jet lag completely and hit the ground running when I get there. So that's that. In terms of what I eat, I alternate between omnivore and carnivore ketogenic diet. So I'm a fan of Mediterranean style and different ones. I mean, I love Indian curry style ketogenic diets and I love Mexican style ketogenic diet, but I think Mediterranean is my go-to when it comes to omnivore. But also half the time I'll just have a carnivore ketogenic meal. Like tonight, it's just going to be steak and butter with an egg on top, a fried egg on top. And that's really simple, and it ensures that the carbohydrate intake is virtually zero. And it's delicious. Steak and egg with butter is it's a very satisfying meal. So that's all I do. There's nothing fancy. There's nothing strange about it. It's just what I do, and I've been doing this for almost 10 years now. And I find it's so hard to tell, compared to 15 years ago when I used to eat a high carb, high-ish fat diet. It's hard to tell, but I'm confident based on some objective data, my blood markers and so on, but also how I feel and my general overall health and function, that this is a very good, this is the way, this is a very good thing. So yeah, that's what I do.
And I'm sure you are well aware that even up to today, there are still a lot of myths going around about these strategies, including for example, the very low carbohydrate ketogenic diet strategy for metabolic health, for example. So if I could ask you, if you could dispel one major myth about these interventions, like for example, the ketogenic dietary intervention, what would that myth be, and why do you think it's worth dispelling?
There are many myths, but I think the most important one to dispel is that it is not natural. The ketogenic diet is a more evolutionarily natural diet than almost any diet, probably any diet on earth. A ketogenic, I should say a low carb diet, of which ketogenic diet is very low carb, but also low carb. If you look at the best studies looking at modern hunter-gatherers, then it is very clear from those studies that people in the northern latitudes, their ancestral diet is before culture, before the last 10,000 years, was ketogenic. People in the temperate zones had some carbs, so they were a very low carb diet. People near the equator, particularly in grasslands, had the highest carb content in their ancestral diet, but it was still only 30 to 40% at most, so a low to moderate carb diet if you're being generous. All of them had meat, and so this is the most important thing, is that low carbohydrate diets are evolutionarily the most normal diet if you look before culture, which is what you should look at, because culture's only been around for a blip in time in terms of human history. 1 or 2% of our human history has been associated with culture. We were mostly hunter-gatherers before that, and those hunter-gatherers ate low-carb diets across the world, across all our ancestors. People in the north, more ketogenic diets. And I do find that my patients who are sort of European background gravitate towards the higher strength ketogenic carnivore diets more, because and people of Asian ancestry or equatorial ancestry in my clinic, they gravitate more towards having higher vegetable content, and that makes complete sense to me evolutionarily, because the ancestors, although all would have been low carb, would have varied somewhat in their ancestral diets based on what food was available in those latitudes. So that's the greatest myth, is when people say the word ketogenic, they think it's some strange, bizarre term, but it's far more natural for us to be ketogenic or low carb and in a ketogenic state than it is to be in the state that I call glucosis, which is where our bodies are running on glucose all the time, and we're eating these high carb, high-ish fat diets all the time, several times a day. That's an unnatural state. So most people, they're existing with an unnatural dietary lifestyle. And if you can understand that singular misconception, that's great. If you understand that, because then you can embrace a more natural dietary lifestyle that's in many ways more metabolically healthy than what most people in the world eat today.
So I agree with you in that we really can get a lot out of studies made in evolutionary biology and human anthropology, especially when it comes to these what we would say ancestral diets that our thousands of years ago ancestors have been having, which is still towards the low carbohydrate side. So for the benefit of everyone listening in, Dr. Phillips, what practical advice would you give to them, especially to those who are intending to adopt a better metabolically healthy way of approaching their lifestyle for the benefit of their health span and lifespan?
Okay, so these are people without a significant neurological disorder, just the general person? Okay.
Yes.
So first is to realize that most people on Earth are overweight or obese and do not have poor metabolic health. In fact, in Western countries, they say 10% of people have good metabolic health, as in they don't have any of the factors of metabolic syndrome. I suspect it's, if you look at optimal metabolic health, it's on the line of under 5%. So very, very rare. So first is to realize that perhaps one's own metabolic health is not optimal. And how does one fix that? And why should one fix that? It's the psychological realization that's so important and key before you start these things is why should I do this? Why should I change my dietary lifestyle? Because it's going to be a thing I do forever, hopefully. Well, the reason is to improve mitochondrial health and prevent the development in 10, 20, 30 years of heart disease, of type 2 diabetes, of most cancers, of Alzheimer's, and all these things. Now, this is, we need more data before we can be sure about this, but I think the data is highly suggestive. So this is, why am I doing this is so important before you embark on the how. Why am I going to do this? Because it's something I'm going to do every day. Now, that's step one. Step two, intermittent fasting. Just start simple. Start with intermittent fasting. Knock down your meal frequency. I say 2 meals a day because it's relatively easy for most people to do. And just 2 meals a day, an hour to eat each meal. Water, tea, coffee between the 2 meals. Eat what you want during the meal for an hour. Enjoy it. Go to a nice big dinner or whatever and enjoy it. But make sure you're only having 2 of them a day. And once you get good at that, step 3 is to capitalize. Start introducing OMAD, 1 meal a day. So 2 or 3 times a week, try to make that 1 meal a day. Okay, so that's step 3. So once you do that, you have a very nice power, and do that for months or even a couple of years before you do anything else. Once you get the intermittent fasting in place, you will become more used to being ketogenic. Your body will gravitate towards step 4, which is to go low carb and or ketogenic, because you will want to, your body will start desiring the fat more and the carbs less, because you already started that adaptation process with your fast. Once you get that on point, some nice low carb or ketogenic dietary lifestyle, you've got the whole dietary lifestyle thing figured out. Then once you're adapted to that, I would say, and of course you can do these things all in combination, but if you want to do it really in sequence, then you embark on good exercise protocols with recovery periods between the exercise sessions. And you make sure that you're going beyond that, the next steps 5, 6, 7. Make sure you're using your brain for good cognitive activities that require sustained attention and are worth doing, not like trolling social media or something like that, but doing hobbies and things you love to do that requires patience and time and effort, and then giving yourself a rest from that. And a lot of the rest of the exercise and cognitive activities is focusing hard on your sleep. Make sure you have a really good sleep and you're focusing on sleep hygiene measures. There's so many ways to do that. And when you're not asleep, focus on these things called non-sleep deep rest protocols or yoga nidra style protocols. And that can involve a bit of body mapping, meditation techniques, breathing techniques, visualization techniques, and so on to help get your brain into a nice relaxed state, but you're still awake. So these are many things that a person can do in order to improve their metabolic health. It's not just do this or do that. I think that's it's an ongoing, lifelong process that one never perfects. But you can always you can get really, really good, but you can always get better. And so the key element to start the whole thing is actually just self-awareness. It's just realizing that this is a very healthy lifestyle if my goal is to be healthy. And then step 2 is to start that intermittent fasting protocol and build from there. This is if you want to be healthy. And if you want to be super fit, this is not the best thing, right? So fitness is like you're really strong or fast or really good at some sport. That's different. That's different. There's overlap between health and fitness, but a lot of things that make you really fit are not healthy, such as ultramarathon running. It's not healthy, but it makes you super fit. So, or powerlifting, you could argue is not healthy, or extreme bodybuilding is not healthy. But, for the fitness goals that those people are after, there's no denying they become very fit. So this is important to realize. Why am I doing this? Before you embark on the process. That's the key element.
That's a great concept you have there. It's like I heard this quote once. It's hard for you to do the house in your life if you do not establish your why. So it's like if you have no reason for doing these things, it's really hard to stick to the discipline of keeping these strategies in place for a lifetime. If day in and day out you don't have enough motivation to do that because you don't have enough reasons to be doing them in the first place. So I appreciate that input you got there, Dr. Phillips. So are there any final thoughts or perhaps a takeaway message that you would probably like to impart to everyone listening right now before
No, I think
we're done?
The last 5 minutes was my take-home message. I'd just like to say thank you to you, Don, for the opportunity to speak. And I think, a lot of these metabolic health issues, they're established in countries like New Zealand and Canada and the United States already, but they're increasingly going to become a burden on the health systems of Philippines and a lot of other countries in Asia, Africa, and South America. So most of the world, in other words. I think they've yet to see a lot of the apex, the serious problems associated with this. So what you're doing is such crucial and critical work over there. I just want to applaud you for being such an early front runner in this sphere in the Philippines. I think that's wonderful. So. Yeah, well done and thank you.
I also give you a huge salute, Dr. Phillips, for these researches that you are trailblazing in neurology, specifically in metabolic neurological interventions for this really serious disease that humanity is facing nowadays, mostly due to changes in our lifestyle in the more recent years of the human civilization, so if we would say. So for everybody interested to know more about your work and to follow everything that you have been doing and you are still doing in terms of the research that you do right now, how and in which platforms are they going to be able to follow you?
I don't have many platforms. I've only got one platform, which is X. So I'm at the handle, I think, I never remember this, at Dr. MCL Phillips, I think, or it could be at Dr. Matthew CL Phillips, but I'm on X. And the other way, the better way, though, is we have a website, metabolicneurologist.com, that a person can go there, and I've put up our major studies, and all the videos, like this one, will go there, and any presentations I put online, which is not too many, but there are some there that might be of interest. I think those, between that website and the X platform, that's the only way to find me.
Okay, so I'll put that in the show notes below this
Sure.
podcast, Dr. Phillips. And so with that, I really appreciate the time you are spending here and all those things that you have shared in the Low Carb Health Doctor podcast for the benefit of everyone listening in and following my platform. And so again, thank you very much, Dr. Phillips.
Thanks, Don.